I could go through this with my head down, really feeling sorry and all the awful things that were happening to me, or I could have a good time. And that sounds really counterintuitive to say, have a good time while you're having cancer or having cancer therapy. But that really helped me.
I went through a lumpectomy and radiation, and I never really felt physical pain, and that really surprised me. And also what surprised me was the emotional pain that I felt instead.
It does take a lot of emotional endurance when you have to go through the treatments, when you have to see other people going through the treatments, and when you feel like, you never expected that you would be in that position.
We offer support service not only just to the patient, but also to the families to be involved in the treatment process. And this would help the patient get through this very difficult journey.
The radiology, the rad techs were great in telling me what they were going to do. And the first video that I saw, too, of what the machine looks like and how it works, I think was very helpful.
My full-time job became becoming well. So that included sleeping when I needed to, exercise, eating right, taking care of myself.
I worked through the first 11 weeks of chemo, full-time, actually overtime. But I got to the point where I had to stop and say, okay, I have to take care of me.
Regardless of my diagnosis, regardless of how much control I have with my disease going forward, I take every day and I say, what am I going to do to take care of myself?
And I made a checkoff list with each of my surgery date, my chemotherapy dates, my radiation weeks, and I checked those off when I was done with them.
I see myself as their cheerleader. So once the decision is made that chemotherapy is necessary, I try to present it as a task that can be done and that is finite.
One of the things that I did to get through my chemotherapy sessions is I had a lot of support. I had friends that would stop by. My husband went to every therapy session. I had a girlfriend who would leave a goodie bag at the front desk for me that had magazines, candy bars.
The side effects from chemo, I think, were probably the hardest, and it was a few days of feeling just kind of blah, and those were the days I slept as much as I could.
Sometimes I expect more of myself than I can produce, especially when I was going through primary treatment. And I found that I just had to sit back and relax.
The loss of my hair was not as much of an impact as I thought it would be.
I went to this one wig shop and tried on a couple. They weren't me. I said, okay, show me your most outrageous hats.
I actually went in advance of when I knew it was going to fall out, and I had my favorite hairdresser shave it for me, and so that I was in control of taking it off. When it started to grow back and was just about this long, that actually it felt pretty good to go without it. And I kept my hair very short for at least a year afterwards, once I realized how it could look good and it was very, very easy to take care of when it was short.
No matter how bad a given day is, and you may have a rough day or you may not, it's only a day, and the days of the chemo period pass.